This conference will now be recorded.
Hear you. Do you listen to me?
Yes, ma'am.
Yes, ma'am.
Okay. Good morning, my dear students. How are you?
I'm fine.
Okay. How do you passing your time?
I'm nothing. Studying sometimes.
Nothing. You don't waste your valuable time because you are final year.
Yes, ma'am.
You have exam immediately. So
Yes, ma'am.
don't waste your valuable time. Take care of your own time. So okay, I am to give you new lectures. Welcome for my today's lectures. I'm going to talking about the vaginal discharges. Vaginal discharges. You have experienced these discharges. Every woman experiences vaginal discharge during her lives, even in before reproductive, during reproductive age, even during after menopause. So it is a common symptom. Maybe vaginal and vaginal discharge may be physiological or pathological. It is a common symptom in our daily practices. So it may be physiological or pathological. Sometimes it's related with the sexually transmitted infections. Vaginal discharge is usually produced from the glands of the vaginal wall and the cervix that drain from the vaginal opening. So it's come from the glands of the vaginal wall and also cervix, and also from the Bacterial glands or parietal gland, which make the external vaginal wall void. Physiological discharge usually present every woman, but when it becomes excess in amount, it's called the leukorrhea. Okay, it's called when excess discharge is called the leukorrhea. Now come to its types. Other than the physiological discharge, it may be infective or non-infective. Non-infective causes I will discuss about during the respective subtopics. Is now infective discharge. It may be related with the sexually infection or to sexually transmitted infection or non-sexually transmitted infections. Regarding physiological discharge, it is usually odorless, colorless, not associated with other symptoms. It is usually present, especially during the mid-menstrual cycle. Mid-menstrual cycles during the near ovulatory period, during ovulations. So it is due to hormonal influences, especially due to the high estrogen, pre-ovulatory high estrogen. High estrogen, it causes the excessive vaginal discharges. And also it is increased during the sexual excitement and also during pregnancy. So it's the physiological discharge. It is clear in color, not associated with itching or other symptoms. But non-infecting other causes are cervical polyp, foreign bodies, and other contraceptives. Some other sound, I'm very some other sound. Do you hear me? Do you hear me? Do you hear me?
Yes, ma'am.
ম্যাম শুনতে পাচ্ছি।
Okay.
জি ম্যাম শুনতে পাচ্ছি।
Okay, thank you. Foreign body, some foreign body lacks retained tampon which is used during the menstruation, and some vulval dermatitis, some chemical radiations, and some IUCDs also. And sometimes oral contraceptives causes the excessive vaginal discharges. Sexually transmitted infections are chlamydial, so mostly chlamydial infection, gonococcal infection, herpes simplex infections, trichomonas infection, and vulvovaginal candidiasis. And non-sexual transmitted infections are bacterial vaginosis. I also told you the physiological discharge, character of the physiological discharge. It is white or clear, and sometimes it's thick or thin, and mostly odorless or slightly odor. Sometimes when normal vaginal discharge is a common presentation during the reproductive life, it's common. It's not when it is deviated from its normal discharge, then we are conscious about this complaints. So for the diagnosis of the vaginal discharge, history taking is very important. So record about its color, odor, presence of blood, relationship to the menstrual cycle, and associated symptoms like itching or bloody discharge, and also past history and sexual history, obstetric history, gynecological history, contraceptive history, menstrual history, drug history, family history, and social history. These are the history should take. And then nature of the discharge should anchor, and if it is physiological discharge, it is clear white color, or in case of gonococcal or chlamydial infection, it is mucopurulent or sometimes purulent discharge. And vulvovaginal candidiasis, it is cloudy white discharge. And yellowish, grayish, or frothy discharge, it is trichomonasis. And grayish white discharge or creamy white discharge in case of bacterial vaginosis. So for the diagnosis, examination should done. Speculum, especially speculum examination, is very important. Now, regarding the gonococcal infections, you know it better. Here the discharge is mucopurulent discharge. When it is complicated, it produces, along with the discharge, it produces the dysuria, lower abdominal pain, and postcoital or intermenstrual bleeding. It is caused by the Neisseria gonorrhoeae. It is the gram-negative diplococcus. Affects mainly endocervix. 50% women are asymptomatic. Its incubation period about 2 to 7 days. Common age group is reproductive age group, especially during the age of 15 to 24 years. It sometimes produces various complications like Bacterial abscess, pelvic inflammatory disease, when it causes the acidic infections, and sometimes disseminated gonococcal infection and produces the fever, septic arthritis, and blister near the small joints, perihepatitis, infertility, and mother to child transmissions like ophthalmic pneumonia. For the diagnosis, sample is taken from the endocervical swab, vulvovaginal swab, and it is a gram-negative. But gram-negative, it is cellular diplococcus. When when you see in the microscopic, you show the gram-negative intracellular diplococcus. It is a rapid diagnosis. But for further confirmation, we can keep. You should do culture of the gonococcus by thermatin media. It shows the grace colony. And also nucleic acid implication test should be done. Our treatment is easy. Here we can give ceftriaxone 250 milligram IV or IM. or cefixime 400 milligrams state, or ciprofloxacin, ofloxacin also. In these cases, partner tracing is very important, and partner should treat it. It is very important. And adverse sexual relationship until both partners complete cure. So it is gonococcal infections. Now, chlamydial infection. It is also a STD, sexually transmitted disease. It produces the purulent and mucopurulent discharges. When it is complicated with PID, it produces the dysuria, lower abdominal pain, postcoital intermenstrual bleeding, and dyspareunia. Same as the gonococcal infections. Chlamydial trachomatis, it is also gram-negative obligatory intercellular bacteria. 70% cases it does not produce any symptom. It produces many complications like pelvic inflammatory disease, and ultimately causes the ectopic pregnancy and infertility. You are already talked about the pelvic inflammatory disease and its consequences like ectopic pregnancy and infertility. And perihepatitis, it is also not uncommon. And sexually acquired reactive arthritis, may occur. And in pregnancy, it causes the preterm birth, postpartum infection, and ophthalmic menorrhagia. For the diagnosis, endocervical swab and vulvovaginal swab should take. And microscopically, it is not diagnostic, not confirmatory, but the polymorph nuclear leukocytosis occur more than 30 and 30,000. And high power field, you don't show any intercellular diplococcus. When you, in absence of intercellular diplococcus, diagnosis is made, it's a non-gonococcal cervicitis, gonococcal cervicitis. So for that confirmatory diagnosis, it is not easier. Many centers do not have any confirmatory diagnosis. Some higher center needed. So in these cases, for the confirmation of the diagnosis, you should do PCR, polymer chain reaction, or ELISA. And tissue culture is the confirmatory. 100% confirmatory is the tissue culture. For the treatment, I can give ceftriaxone. Hello? Hello? Do you hear me?
Yes, ma'am.
Okay.
Okay,
I continue my lecture. For the treatment of the chlamydia, we can give doxycycline 100 milligram BD for 7 days. Azithromycin 1 gram, especially in case of pregnancy, and some drugs also may have for the treatment. Here also partner tracing and treatment of the partner also needed. And here also adverse sexual relationship until the both partners complete the treatment. Now, trichomoniasis, it is also STD. Here the profuse, frothy, yellowish, grayish, or greenish foul-smelling discharge. The special character is frothy, yellowish, or greenish discharge. Special character with foul-smelling odor, foul odor. And it is associated with the disease area, lower abdominal discomfort, vulval itching, dyspareunia. On examination is show strawberry cervix, that is the small, very multiple hemorrhagic area on the cervix. When remove the discharge, you can see the small hemorrhagic area on the cervix. It is caused by the trichomoniasis. Trichomoniasis is the most common sexually transmitted infection in the worldwide. It is a flagellatous protozoa. mainly affect the vagina, urethra, and periurethral gland. 10 to 50% of the women are asymptomatic. Its complication during pregnancy, it causes the preterm birth and low birth rate. So for the diagnosis, investigation secretion from the posterior fornix collected into the swab and observed under microscope. Microscopically, you can see hyphae, spore, etc. This is a candidiasis. It is an oval budding fungus. Pathogens 80 to 92% cases Candida albicans, and other albicans, non-albicans, especially Candida globotra, tropicalis, and yeast also. Produces discharge, scardy white discharge. Special characteristics is scardy white discharge. Scardy white discharge, it is a non-offensive vaginal discharge. Non-offensive vaginal discharge. It's scardy white. It's not offensive, not bad smell, but it produces scardy white discharges. But it produces vulval itching. Most characteristics of the Candida is the vulval itching. Very disturbing complaint is the vulval itching. But in trichomoniasis, discharge is huge amount of discharge than the itching. But in candidiasis, most disturbing is itching, and it produces scardy white discharges, but it is non-offensive. And sometimes excessive itching produces the vulvar soreness. And it produces superficial dyspareunia due to the vulvar soreness. On examination, you show erythema, fissuring, and edema. Predisposing factors including diabetes mellitus, long-term steroid, pregnancy, prolonged antibiotics, and also immunosuppressive condition like HIV or malignancy. In this condition, excessive discharge due to the candidiasis is a common presentation. For the confirmation of the diagnosis, vaginal swab should take from the lateral fornixes. Microscopically, you can see hyphae and spore, but confirmation done by the several agar media. আর তোমাদেরকে মনে একটা স্লাইডটা আমরা মিস করে গেছি, সেটা হচ্ছে trichomonas. In case of regarding trichomonas for confirmation of the diagnosis, microscopically you can see the hanging drop precaution. Trichomonas for the diagnosis you show hanging drop precaution. For further confirmation, you culture may done by Feinsbury Partington media. তোমরা লিখে রাখো culture done by Feinsbury Partington media. And in case of candidiasis, culture done by several agar media. In case of candidiasis, culture done by several agar media. For the treatment, good hygiene is very important. Hygiene should maintain and remove predisposing factors like when patient may take long-standing steroid or oral contraceptives also. Oral contraceptives. ফোনটা একটু রিসিভ করা তো, যে বলো তো আমি ক্লাস নিচ্ছি নিচের দিকে কেন। আচ্ছা, তারপর হচ্ছে predisposing factors should remove. And for orally, we can give some antifungal drugs like fluconazole 150 milligrams stat or itraconazole 200 milligram BD for 3 days. And local application like clotrimazole, miconazole, cystatin, iconazole, etc. We also can give pessaries, or pessaries intervaginal pessaries for 1 to 2 weeks. Here, no need to epidemiological treatment for the partner. But barrier is the protective methods. And then bacterial vaginosis. It is not STD. It is not STD. Bacterial vaginosis. Bacterial vaginosis. Bacterial vaginosis is not a sexually transmitted infection. Yeah, the frequently causes the vaginal discharge, especially during the pregnancy. It is an anaerobic or facultative aerobic bacteria. Yeah, the normal vaginal flora of lactobacillus is replaced by growth of other organisms like Gardnerella vaginalis, Prevotellus, Mycoplasma hominis, and Mobiloncus. These are the components of the bacterial organism of the bacterial vaginosis. Here the pH is more than 4.5. pH increases more than 4.5. Clinically, it produces grayish white homogeneous vaginal discharges. It produces the fishy characteristic of fishy order. It is the diagnosis. So it is we can mark that the grayish white homogeneous vaginal discharge and offensive fishy order, but no vaginal inflammation. There is no vaginal inflammation. For the diagnosis, microscopically, we can see a special type of cells. It's called the clue cell. It is the most diagnostic point is presence of clue cell. It is the diagnostic for the vaginal it is diagnostic for these diseases. Bacterial vaginosis is diagnosis by the clue cell. Clue cells means it is a epithelial special type of cell where the epithelial cells covered with a special appearance, strip appearance, and it produces diagnostic for the diagnosis of the bacterial vaginosis, presence of clue cell and unique grayish discharge on naked eye and pH more than 4.5. And special characteristics of fishy order being addition of alkali, that is the 10% potassium hydroxide. When adding the 10% potassium hydroxide, it produces characteristic fishy order. It is also called the whip test. You can put it whip test, W-I-F-F, whip test. Is the characteristics. For the treatment we can give metronidazole. Metronidazole is a treatment, it's not very difficult. You can give only metronidazole 400 milligram to 500 milligram twice daily for 7 days, or 2 grams stat is enough to treat this bacterial vaginosis. Now, other variant is non-infective cause of vaginal discharges. Non-infective cause of vaginal discharges. This is the retained forgotten foreign bodies like tampon. Sometimes it in case of vaginal, in case of prolapse, vaginal, or sometimes patient uses the vaginal ring. It produces the vulvovaginal infection and fast-moving discharges. And sometimes patient may have vaginal cervical polyp. It also produces vaginal discharge. Along with discharge, it produces intermenstrual bleedings. Other cause of non-infective or non-infective vaginal discharge is the endometrial carcinoma. And also carcinoma cervix. It produces a discharge. It is not infective. So neoplastic cause is important cause is endometrial carcinoma and also carcinoma cervix. So some scenario regarding the vaginal discharge. That 27 years old female presenting with a mucopurulent vaginal discharge for 1 day, also complaining dysuria, lower abdominal pain, postcoital bleeding. She has recent history of having unprotected sex. What's your diagnosis? My student, answer me, what's your diagnosis? Do you hear me?
Candidiasis.
Mucopurulent discharge. Candidiasis produces cardiovascular
Ma'am,
discharge.
gonorrhea. Ma'am, gonorrhea.
Yeah. It may be gonorrhea. Gonorrhea, mucopurulent discharge, gonorrhea. It is a important causes of STD. It produces mucopurulent discharges, and it also have dysuria, lower abdominal pain, and postcoital bleeding. So it is a case of gonorrhea. Okay, thank you. Next scenario. 27 years old, presenting with profuse frothy yellow grayish discharge with foul smelling, foul odor for 1 day, and also complaining dysuria, vulval itching, and dyspareunia. She has also history of unprotected sex.
Ma'am, trichomoniasis.
Trichomoniasis. Okay, thank you. Very good. It produces grayish yellowish discharge. Grayish it is associated with vulval itching. Here the profuse for the yellowish grayish discharge with foul smelling discharges, and it has also vulval itching and also dysuria, sometimes dyspareunia. So what's the treatment? What's the treatment of this of these diseases? Metronidazole. Yeah. Trichomoniasis treatment of metronidazole. Treatment of trichomoniasis by metronidazole. Metronidazole 200 milligram TDS or 400 to 500 milligram BD for 7 days is enough to treat these cases. Okay.
Yes,
now another cases 25 years old presenting with thick white vaginal discharge for 1 day and complaining dysuria, vulval itching, and soreness. What's your diagnosis?
Candidiasis.
Okay, it's vulvovaginal. Okay. It's a vulvovaginal candidiasis. Vulvovaginal candidiasis factors. What are the predisposing factors?
Diabetes mellitus, long-standing steroid, pregnancy,
Okay.
or a prolonged use of antibiotics, oral contraceptive, or immunosuppressive conditions.
Thank you. What's the treatment?
Treatment হচ্ছে ম্যাম proper hygiene maintain করতে হবে or antifungal drugs, oral and topical antifungal.
Removal of the predisposing factors. And treated by the antifungal drugs, that is fluconazole. Oral fluconazole, that is the 150 milligram dose, and
itraconazole 200 milligram
BD করে দিচ্ছি twice daily for 3 days, and also local application
miconazole,
nystatin, iconazole, that's all. Or vaginal pessary, we can also use vaginal pessary, cotrimazole or iconazole. We can give vaginal pessary. Okay.
Yes, ma'am.
These are the common vaginal discharges. Bacterial vaginosis is also not uncommon in our country. Bacterial vaginosis, it produces creamy discharge. Creamy is grayish, creamy discharge. creamy discharge. So sound হচ্ছে কি জানেন, extra sound হচ্ছে, extra sound হচ্ছে, added একটা sound পাওয়া যাচ্ছে। So creamy discharge during pregnancy, it complicates to preterm labor, where sometimes it produces premature rupture membrane and chorioamnionitis. So it produces low birth weight baby. So be aware of it. Bacterial vaginosis, it complicates many complications during pregnancy. So it is treated by metronidazole. Metronidazole 400 to 500 milligram BD for 7 days, or 2 gram stat dose is the bacterial vaginosis. So character of the discharge, you can diagnose the what type of disease is affected. So when it produces mucopurulent discharge, it may be by gonorrhea or by the chlamydia. When it produces cardioid discharge, it is the vulvovaginal candidiasis. When it produces the yellowish, grayish or greenish discharge with false meaning order. False meaning order is trichomoniasis.
Trichomoniasis.
Okay?
Yes, ma'am.
So for the diagnosis, character of the discharge is very important. But when the excoriation present, sometimes excoriation present in case of when the itching present, itching especially present in candidiasis and trichomoniasis. Yeah, during candidiasis, intense itching is present, but in trichomoniasis, more profuse discharge present than the itching. So these two diseases associated with the itching, you can easily differentiate it from the other conditions. So sometimes strawberry appearance present in the cervix in case of trichomoniasis, but in candidiasis, edema, fissure on vulva vagina sometimes produces red color, and excoriation also present in candidiasis. So you can easily diagnose easily, you can treat her easily. So, and another causes like physiological discharge, you should not need to any treatment. Sometimes patient come to you with excessive vaginal discharge. You ask about her disease condition, associated any condition. When excessive discharge may be present in middle of the cycle due to the hormonal influences, and you just assure her. Sometimes excessive discharge due to the ill health or some psychological condition, when excessive stress, chronic ill health may cause excessive discharge. No need to treat her, and psychological improvement is important. These are the another important scenario is a 33 years old presenting creamy vaginal discharge with fishy odor. You have already told her no itching. Creamy discharge, no itching or soreness. What's your diagnosis? Creamy discharge. Okay. Bacterial vaginosis. It is caused by the bacterial vaginosis. Bacterial. Creamy discharge. Creamy discharge, I have already told you, fishy odor. Characteristic fishy odor with creamy discharge, and there is no itching, no signs of inflammation, bacterial vaginosis. Bacterial vaginosis is caused by Gardnerella vaginalis, Bovitera, Mobilancus. It's the common organism for bacterial vaginosis. It's a group of infection, group of some bacterial infections. Group of subterm bacterial infection, it causes the bacterial vaginosis. It produces creamy vaginal discharge with characteristic fishy odor. Okay. This is all of my today's lecture. Please, my dear student, don't waste your valuable time and stay at home and stay safe. Okay.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
I will
Thank you,
talk
ma'am.
next time. Okay. Thank you.
Assalamualaikum.
Walaikum salam.
Nah.